Have questions before we continue on? This could be anything, and it could be anything random. Don't worry. Anybody? Whilst we wait. What about Angel? Do you guys have questions? Or Anna Jamema, Charisse, do you have questions? You can answer. You can ask them now. I won't mind. But if you have none, let's begin with our next topic, which is infection control. Infection control, sir. Why are you asking this question? Is this gonna be part of our boarding? Hello? Can you guys hear me now? All right, sorry. There was a little bit of a mishap with my headset. But anyway, let's continue. I wasn't muted, don't worry. Hindi ako nagsasalita na tuloy-tuloy na. Tinitignan ko na yung lecture ko tsaka yung sound system. All right, so let's try to differentiate first what is disinfection from, let's differentiate different sterilization from disinfection. Without trying to look at the next slide, I want somebody to differentiate for me sterilization and disinfection. Anybody? Anybody? Sterilization and disinfection. In your own words. Come on, guys. Don't worry, if you made a mistake, it's not a problem at all. Don't worry about it. I wouldn't mind. Anybody? Um, okay. Somebody raise their hand. Please unmute yourself if you raised your hand. Okay, Adrian. Uh-huh. And all right, that's a very good answer actually. And yeah, sterilization means total destruction of any microbial life, whilst disinfection is, from the name itself, removal of microbes that or germs that causes pathologic conditions. All right, or in general terms, the complete destruction of all microbial life, while disinfection for sterilization is the complete destruction of all microbial life, while disinfection is the destruction of pathologic microbial life. So, can you guys give can you guys give me an example of non-pathologic microorganisms that might be affected by sterilization? So this could be what? This could be a fungus, right? Like your skin flora as well, like Propionibacterium acnes, or what else? Bacillus anthracis, which is usually seen in the, yes, spores, hence a term Bacillus anthracis, which is usually seen in the soil. All right. So anything, everything basically that is non-pathologic, we're not gonna. Viruses are also, yes, thank you. But are they considered living organisms? That that is again left for debate. In that is again left for debate. As I mentioned in last week's lecture, there are still some scientists who disagree that they should be considered as living organisms. They do have the genetic material and the potential to replicate. However, they lack the other foundations of a living organism. So there is still debate in the scientific community about that one. And up till now, as I'm giving out this lecture, there are still people who believe they are living organisms, and there are some that disprove that want to disprove this concept. But yeah, you are correct. Sterilization also includes viruses. All right, so disinfection, just anything out of the blue, anything that you can, common disinfectants in your house destroys anything that might be that make you sick. So a great disinfecting agent is what? Your 70% isopropyl alcohol, which is quite commonly advertised right now, primarily because of the pandemic, right? Okay. So now, I want you guys to take into consideration the next slide. What are the three types of physical sterilization? So we have heating, we have ionizing radiation, and filtration. Huh? Filtration, sir? Really? We're gonna start first with heating. Heating is basically just using direct heat, the energy of heat producing substances, heat producing instruments such as a microwave or an autoclave would be sufficient. And ionizing radiation is a little bit more advanced and a little bit expensive, but we'll try to tackle on some of those things. And filtration will be something that would be quite interesting for you guys, I suppose. All right, so types of heat sterilization. Now, guys, I want you to remember the that physical sterilization is anything that reacts with the anything that depends on non-chemical forms of sterilization. So anything that relies on energy or or manually destroying the organisms. That's what we mean by physical. All right. So heat is one of those things. So we have two types of heating sterilization techniques. Please don't forget them. Moist and dry heat. All right, moist and dry heat. You'll realize later why it's important that we have moist and dry heat because there are two types of moist heat sterilization technique, and hope you guys remember this that autoclaving is a physical sterilization technique that is categorized as heat sterilization, and it falls under moist sterilization technique. All right. So autoclaving and fractionalization are one of those two things that you need to remember. And the most effective, based on a number of studies and based on a lot of international standards, sterilization is sorry, um, autoclaving is one of the most effective ways to destroy destroy pathogenic destroy microorganisms. All right, even spore forming organisms, and you'll find out later why. Now, at what temperature, PSI, temperature, pressure, or PSI, and time is ideal for autoclaving? Now, why do I need to ask this? Because every time you are going to answer infection control related questions, 95% of the time they will ask you this question. Please put a star on this one because they will ask you again time and time again, even if it's not a board exam related question. Sometimes they will still ask this to you. In many hospitals all over the world, even if you're working there in, I think in the Philippines, we have there in Medical City. I remember a friend of mine who was working there. They have the accreditors want people to be familiarized with infection control policies, and one way for them to assess whether or not they are competent in they ask the staff to to either through a series of questionnaires or even an actual examination under the infection control committee is they ask concepts of sterilization, and usually I have encountered this during my practice, although not not in my previous employment there back there in the Philippines. But here abroad, they would often ask us, especially for those who are following standard guidelines and procedures. And I want you guys to remember these numbers. Even in the exams, as you go into the practice, you will remember the 121 degrees Celsius, 51 psi, and 15-minute time of autoclaving. All right. And the control organism that we use there is the biological indicator that we use, or the tape, is Bacillus stearothermophilus. All right, the biological indicator. The spores are actually embedded on the my autoclave tape. It's not just an autoclave tape, it's a biological indicator tape if you want to sound posh. All right, so yeah, Bacillus stearothermophilus is the indicator, or the biological indicator that we use. We can use chemical indicators, but that is for central sterilization department procedures, like the ones that they use um, for the instruments that they use on patients. So we're not going to talk about that one because it's rarely asked in our board exam as medical technologists. Now, I want you guys to also remember fractional sterilization, because there are two types of fractional sterilization techniques that are still being used in the clinical laboratory. There's what we call tyndalization and inspisation. So tyndalization is quite different. The difference is that it's done on both of these methods, or fractionalization methods, are done at a longer rate. So it's done on consecutive days, 3 days actually, if you want to be much more specific. But tyndalization is different. 100 degrees Celsius for 30 minutes for 3 consecutive days. So it fractionalizes the sterilization technique in three meetings, whilst at a higher temperature. Whilst inspisation is done 75 to 85 degrees Celsius for 2 hours for 3 consecutive days again. So fractional sterilization is a little bit more costly, but it means that your instruments are fully sterilized, and anything around it is also sterilized. So that's the difference between these two. So in the clinical laboratory, we use autoclaving, but for central sterilization departments, or anything that has something to do with the sterilization techniques of immaterial, or rather of instruments, we use fractionalization. It's just something that we added for you guys because it might be asked in the board exam. All right, so please don't forget tyndalization and inspisation. Inspisation. Now let's move on to dry heat sterilization techniques. So we have what we call the direct flaming methods. All right, so we just use a Bunsen burner and heat the inoculating loop there, and automatically you can do your procedures. All right. And then we also have um, oven. We use ovens sometimes in the laboratory if we have to at least sterilize some materials that we have in the lab, without burning them, of course. And then incineration, which is one of the highest temperature ranges that you're going to memorize. All right, so direct flaming, there's no temperature requirement. All you need to do is wait for the inoculating loop to turn orange red, and then that's it. Wait for it to cool down. You can use it directly for your procedures. It's the most practical for tabletop procedures such as inoculation and um, basically anything that you do in the microbiology lab for testing. And oven is used for certain instruments would that can be stored for longer periods, and then that are stored at longer periods of time, and may contain bacterial substances, such as your flasks, bacterial organisms, or fungal elements, if you want to be much more specific, for longer periods of times. And incineration is basically just burning something up. All right, and in the Philippines, incineration is, I think, banned. If you go to your medtech laws, there's a law there about waste disposal. Okay, waste disposal. But it is because of the environmental effects of incineration. So in the Philippines, it's banned. So if you see or hear somebody doing incineration, your job as a citizen is to report these things, because they're not supposed to be you're not supposed to incinerate your wastes. All right. Speaking of waste disposal, guys, that's part of infection control. Have you guys Have you guys encountered the news wherein in Manila Bay there's bottles of blood culture? Have you guys encountered that news? And I remember when I think it was 2017, right? They're literally, and some of them are actually selling them on the streets. 2017 or 2018, no? Parang, yeah, I know, right? So Divisoria, parang I don't know what it's for, parang mementos or something. But yeah, if you see something like this, please try to notify the authorities because this can actually cause this can have hazardous implications in the well-being not of just community. All right? So yeah. So I think it happened in 2017 where somebody is selling it in Divisoria. I don't know why someone would buy. I really don't understand why someone would buy blood culture bottles. Is it a memento or is it something? Please comment on the chat box if you can understand the logic on buying these types of bottles. Anyway, let's move on. That's just a segue. Let's move on to biological indicators used for ovens. We have Bacillus. This is a long one. I'm sorry. Bacillus subtilis varniger. All right, or Niger. Sorry, if we don't want to sound racist here, but that is the name of the organism. So Bacillus subtilis varniger or varniger. All right. Okay, so we're gonna go with chemicals used in sterilization. So we have to go with chemical sterilization now because this is also again a question that is usually asked in the board exam. So we have ethylene oxide as one, vapors such as formaldehyde and hydrogen peroxide, and glutaraldehyde and peracetic acids. These are chemical sterilizers, and they're often I think the most common one that we use now as vapors is hydrogen peroxide, primarily because it has in the hospital, primarily because it doesn't have any harmful effect when left when left out to dry. So yeah, I think ethylene oxide and glutaraldehyde and peracetic acid are quite harmful to humans, especially even formaldehyde, of course, because it's a carcinogen. All right, so chemicals used for instruments. We have glutaraldehyde, okay, mainly because it's non-corrosive and it's used for metals and rubbers. So if we use glutaraldehyde for sterilization um, of operation or of the some of the operating theater instruments you're going to encounter if you're lucky enough to be allowed in the operating theater. Okay, so glutaraldehyde is one of those things. And sorry, my slideshow ended here. Can you guys still see the slideshow? Hello. All right, thank you. All right, now let's move on to physical methods of disinfection. So we have physical, chemical, and then you have to identify whether or not it's disinfection or sterilization. So they will ask you a question, which of the following is a sterilization technique? Which of the following is a physical sterilization technique? So you guys have to remember these things as well. Physical disinfection techniques. So we have boiling, of course, and then you also have pasteurization and the use of non-ionizing radiation. Non-ionizing radiation in the layman's term is the UV light, right? Okay. I don't know if you guys still have it there, but I remember there was news in City. Anybody here living in Pasig City that the town hall or the barangay hall or the mayor's office, I'm not sure where it was, but it was in Pasig City. And shout out to Mayor Vico Soto for trying to help the community of Pasig to stay away from infection. But I remember they have roving UV light, roving robot UV light stands there. It's basically what it does is it flashes UV lights at consistent rate all over the place, and it's moving and it's cleaning the floors as well. I'm not sure if you're familiar with that one, but I don't know if it's the barangay hall or the town hall. I'm not or the mayor the yeah, so something like that. But anyway, because we were talking about non-ionizing radiation, you have to remember that one of the non-ionizing radiations is your UV. The UV spectra is actually a non-ionizing form of radiation. Okay. Um, what's the difference of ionizing radiation? It's basically the energy levels, right? So it's going to fall under the line of physics. So that's not our main focus here, probably in some other lectures. But this time we're going to talk about forms or two forms of pasteurization. We don't have other more. We don't need to remember anything about boiling. All right. So boiling is basically the most primitive way of disinfecting items or disinfecting instruments. But we're gonna move on with pasteurization because pasteurization can be done in either a batch method or a flash method. So batch method has lower temperature holding, which means that it can, but the purpose of this one, but the but the amount of time you need to pasteurize something is about 30 minutes. So the lower the temperature, the lower for batch pasteurization, the lower the temp you if you lower the temperature, you have to increase the time of exposure. So 30 minutes of exposure to heat. All right. So flash pasteurization is high temperature and short time holding. All right, so it's 72 degrees Celsius for 15 seconds. And actually, side note here, if you go to food processing plants, flash pasteurization is actually done. All right. So side note here, if they add food microbiology questions in your board exam, if they ask you which of the following is used for for food packaging, the type of pasteurization done is you're going to use flash pasteurization. All right. Now, what is the importance of pasteurization? Why do we need to still do it? Because why can't we just autoclave everything? Um, because if you autoclave something, since many food products get disintegrated at extremely high temperature and high pressures, the taste value decreases as well. So it's more of a practical application rather than in a healthcare perspective. So that's the reason why we added pasteurization here because sometimes they might add industrial microbiology or food microbiology questions in your board exam. So yeah, okay. Examples of chemical disinfectants. So we have alcohols, halogens. What else do we have? Heavy metals, I guess. Yeah. And then what else? Quats, quaternary ammonium substances or quaternary ammonium products. And I think phenol is one of those things, if I'm not correct, if I'm not mistaken. Yeah, okay, so yeah, alcohol, halogens, heavy metals, quaternary ammonium compounds, and phenol. All right, so alcohol is the most common antiseptic in the laboratory or even in healthcare facilities. And we use 70% alcohol. If you're not sure how much, it's 70% isopropyl alcohol. And 75% ethyl alcohol can also be used. Can we use methyl alcohol? True or false? Methyl, methyl. Yeah, methyl. Can we use methyl alcohol? True or false? It's a question. It's not in the slides, but yeah, I'm going to ask you a question and this question anyway. False? Yes. Correct. Why can't we use it as a disinfectant? Uh, anyway, so it's a safety protocol question. I think in in ASCP question bank, in an ASCP question bank. I want people to remember this question. because these are the three types of alcohols that are usually present in the clinical laboratory: isopropyl, ethyl alcohol, or ethanol, and methanol, or methyl alcohol. Why can't we use methyl alcohol in the laboratory as a disinfectant rather? Anybody? Okay, so again, I'm gonna start asking people questions. We're gonna start in the middle, the one above Joanna. Charisse. Charisse, are you there in the line? Wow, are you there in the line? Charisse. Hello, Charisse. Ah, medyo nabingi ako sa static. All right. Why can't we use methyl alcohol or methanol? Um, that is the one that I'm looking for. What are the side effects, or rather the harmful effects, or let's be specific, what are the health effects of methyl alcohol to humans? This is a hematology related question, guys. I'll tell you guys why. What about Cesar? Cesar, medyo matagal kong hindi narinig ang voice mo. I wanna hear your voice. Cesar, are you still there? All right, so we don't have Cesar on the line. Let's move on to Reniel. All right, nobody answered as well. Okay, what? What was the answer, Reniel? Or Cesar, sorry. What is the harmful effect of methanol to humans? Health effects pala. Health effects. Charis, you raised your hand earlier. Charis? Huh? Nagiging formaldehyde? Dermatitis? Somebody answered dermatitis. No. Oh, Rainiel. Birth defects in the CNS. Nasa clinical laboratory ka, tas buntis ka. Hihit-hit ka ba ng ano, ng methanol? Ikaw talaga, Rainiel. Diba? Google answer na naman siya. It's a typical Google answer. All right. But yeah, you're kind of correct because it causes birth defects, but that's not the question, but that's not the answer that I'm looking for. It's harmful to people who are working in the clinical laboratory because it can cause blind blindness, to be specific. Yeah. So blindness. You're almost there. You're almost there, but yeah. So please be specific next time. Conjunctivitis. All right. Thank you so much, Rainiel, for enlightening us. It can actually cause blindness. And it was a question in my friend's hematology exam. Methyl alcohol is a common fixative the is a common fixative in hematologic stains. As a clinical laboratory scientist or as a medical technologist, what precaution should be why is what to call this universal precaution should be of utmost importance because of the following side effects of methanol: blindness, blindness, skin burns, or other unrelated things. But blindness is the correct answer, actually. All right. So examples of halogens that are commonly used as antiseptics is iodine and chlorine. Chlorine. All right. So we use iodine and chlorine as a disinfectant. Sorry, what happened? All right. So yeah. So iodine and chlorine disinfectant or antiseptics. All right. So iodine is prepared in an iodophore. It's prepared as an iodophore, and the concentration of an iodophore, and then chlorine is is prepared as sodium hypochlorite. Now, these two are important because in the blood bank, you need to remember this specifically because you want your blood collection system needs to be closed off, and one way to disinfect the site of collection is through one way to disinfection is through the use of an iodophore, which is a combination of iodine and detergent. All right, and then hypochlorite is actually a 1 is to 100 dilution of sodium hypochlorite is actually 1 is to 100 dilution of water and sodium chloride. The most common question here is how much percent of sodium hypochlorite is used in the clinical laboratory for disinfection. Please remember that it's 10%. All right. This is just the preparation and the dilution factor that you need to use, but it's always 10% sodium hypochlorite or bleach. All right. Chlorine is inactivated by sodium thiosulfate. All right, so if you're using uh, thiosulfate related chemicals in the laboratory, please don't forget that sodium thiosulfate inactivates it and renders it as useless. Okay. Now, examples of heavy metals in the laboratory that is used for asepsis traditionally uses mercury. Okay, mercury, specifically merthiolate. Um, Other ones that we can use is copper and silver. These are these are traditional these are traditional chemical heavy metals that can be used for disinfection. Actually, mercury at one point was being used for no, no, yeah, yeah, mercury at one point was being used to cure syphilis back then, before they realized this was actually a toxic substance. So please be mindful of these heavy metals as well. All right. Also mercury, copper, and silver. Now let's move on to a septic technique that is used for Creed's prophylaxis or Creed's disinfection. We use silver nitrate, and the ideal percentage and concentration of this one is 1% sodium nitrate. All right, sodium nitrate. Uh, Please, this was an edited slide, so the G is just a small one. It's supposed to be a small letter, but when I edited the slides, it became capitalized. Everything became capitalized, so please be careful. All right, so yeah. So what is antiseptic use for creed prophylaxis? It is a 1% sodium nitrate. All right. So where do we use the sodium nitrate? When do we use Creed's prophylaxis? Dermatitis. Class yan po yung gene bulag. Yes. Yes. Ang galing-galing talaga. Actually, I have to tell you guys a story about methyl alcohol, methanol. Here in Saudi Arabia, it's forbidden to drink alcoholic substances. Yeah. No, totoo siya kaya tinawag siya yan yung ano, yan yung oo nga, I forgot the term na. Matagal na pa kasi panahon yan, sir. Pinagtatawanan namin yan dati. But yeah, when I first arrived here in Saudi Arabia, I realized that yeah, before I came here to Saudi Arabia, I know that it's forbidden to drink alcoholic beverages, but um, there are some people, I know there are a bit of naughty people here who makes their own their own alcoholic beverages, and sometimes there's a certain species of yeast that that are unknown to people who are making these alcoholic beverages. The instead of making ethanol, the organism actually converts it to methanol. And there was a case, I think, when I first arrived here. There was a case here in Saudi Arabia 2016 or 2017. I'm not really sure, but it was featured in Corina Sanchez's show back then. And the story goes like this: they were trying to have fun. They tried to make their own alcoholic beverages because you can't buy it anywhere here, and it's expensive to to buy the illegally distributed ones. But there are some people who still distribute it here, mind you. Not gonna say I partook in one of those things because as a medical technologist, I came in here and I know that methanol might be a risk factor for me getting blind. And yeah, so there's still a lot of people here who produce it. And one of the people here, there are 5 people who actually got blind when they drank methanol. And yeah, it was featured in ABS-CBN's Corina's late night show, and it was all too dramatic, and they didn't realize they were drinking alcohol, and there was a doctor there that they didn't realize what kind of alcohol they were drinking, and and moral of the story is don't drink anything that wasn't made by that you don't know how it's made, or just don't drink anything at all, especially if it's forbidden already in that particular country. They call it haram in Islamic Islam predominant countries. So yeah, try to avoid it. It's probably karma, I know, because I know day drinking is fun, and I mean recreational drinking is fun, but at the end of the day, would you rather risk your eyesight than have momentary fun? All right, so that's the moral of the story. But yeah, correct si Sir ano don, si Sir Mac don, dahil yeah, it's literally gin bulag. Yeah, I know. Kasi nga ngayon ang iniinom na nila ngayon, Michelle. Oh my God, I'm so old. We're so old na ba, sir? Ganon. No? Feeling ko gano'n na tayo ka-old. Kasi ngayon, pag nakikita ko kasi sa TikToks yung mga tao, umiinom na ng mimosa, mga ka-art, and how to prepare your own mimosa, DIY, DIY, what's that one that they usually drink in brunches? But yeah, Bloody Marys, mga gano'n na yung mga tao ngayon, di ba? I know, right? When I was in college, I'm sorry guys, I'm not promoting drinking while studying, but when I was in college, a lot, especially when I was in medical technology school or clinical laboratory science school, um, what we usually do after exams, just to lay off some steam, is to drink. Because why? It's so stressful. It is stressful. I know it's there's a lot of material. There's a lot of materials. Even interns, they actually invite me when I was still working in the Philippines. Even interns, especially those who are from UST, Sir Marco, especially those I have especially those who are in UST, because you know why I always go with, it's not because I'm a social climber or anything. It's because they have access to the VIP portions of some bars in whatever place they are in there, in Tomas Morato or something. Yeah, yeah, because I have interns from UST who actually own the bars there in Tomas Morato. So yeah, that's the reason why I got influenced to join some of my co-interns, and even when I was working, some of the interns would invite us to the to the lab to their own bars. And yeah, it's fun, it's amazing. But please don't drink before the exam. I've only had one friend who drinks before the exam and gets, I think, 99 out of 100, and that's a rare case. Nobody else has been that way ever since, in my own experience. I think there's one in every batch. They can't answer correctly when they haven't drunken anything, and so yeah. And hopefully you guys can learn not to drink during not to drink during exams, okay? Because we don't want to risk your futures, because you're gonna come on guys. It's hard enough to reach the fourth year, let alone reaching it and then failing all of a sudden, just because you heard this lecture, and we sound like we're promoting recreational drinking to students. But yeah, I still remember my UST co-interns and UST interns. UST interns nako, sir. USD Inters. I remember. And look at you and look at where you are now. You are teaching. Yeah, and I think drinking has actually helped you out in connecting with the younger generation. But there, yeah, yeah. So another lesson for the day, yeah, don't hang out with USC students, but they are fun people to hang out with. Wonderful. Okay, so yeah, let's go on with the most common quaternary ammonium compound. We have zephyram, which is a sporozoidal and non-tuberculoid. Actually, in my training in MTB. I'm not sure if it was an MTB lab, but it was biosafety level 3, I think. They use Zephyram or quaternary ammonium compounds. I'm not sure if Zephyram is the brand name, but I remember it was a quaternary ammonium substance that we use in disinfecting disinfecting surfaces in the TB labs. So please be mindful that you can't just work in a TB lab with a bleach solution and an alcohol swabs. You have to have these things. Okay, quaternary ammonium compounds. That is the reason why there's I think only a handful of hospitals or laboratories in the Philippines that can do mycobacterial studies and mycobacteria like bacterium studies. Okay, because it's difficult to get your hands with quaternary ammonium compounds. All right, so yeah, formula for phenol coefficient. First of all, what is phenol coefficient? It's basically the formula that you use to compare your product. For example, let's select a student from the class. For example, Cesar, he has a company. He wants to start a company, and his business venture is his business venture is something. It has something to do with antimicrobial or antiseptics. What we use to compare that one, what we use to compare his product from is a phenol coefficient. So basically, it's the gold standard on measuring the effectivity or the efficacy of antiseptics. Okay, so you have to compare Cesar's product with um, you have to compare Cesar's product with a phenolic or with a phenolic substance in order for it to be accepted in the market, or if in order for it to have a patent for distribution. And I think a lot of companies in the Philippines, and even I think a lot of companies in the Philippines bypass the phenol coefficient testing. And it's a sad reality, but yeah, some companies tend to bypass it because of corruption and something. But yeah, but my political affiliation is not the topic of this lecture. So yeah, how do we calculate the phenol coefficient? So basically, this is the highest concentration of the disinfectant that can kill an organism at a given time, and then we use phenol concentration, the highest concentration of phenol that you can use to kill an organism at a given time. So it's different from your MIC and MBC. This time it's measuring the highest concentration that can kill an organism or all organisms in a given sample at a given time. All right. Do they ask this in the board exam? They just ask you the formula. That's why I posted it here, and that's what they also told us in the review centers. All right. So if they have other questions related to these, please don't forget to remind your professors or even me. You can send it to me, and then I will edit this one for future reference. But yeah, that's the standard for calculating this. Now we use test organisms to calculate the phenol coefficient. Um, One of these is your Staphylococcus. One of the organisms is Staphylococcus aureus, and the other one is Salmonella typhi. Um, of course, they have the ATCC requirements. Of course, the genomic what they call this, the genomic data of this particular organisms. But for this particular lecture, I don't think it's important. So just remember that we need to use test organisms or control organisms in the calculation of phenol coefficients. All right, so it's Staphylococcus aureus and Salmonella typhi. All right, so now how do we interpret phenol coefficient results? A disinfectant is better than phenol if if it has greater than one. Okay, if it's less than one, it means that phenol is better, and if it's equal to one, the if the phenol coefficient is equal to one, that means that your phenol and your disinfectant is equally better or on par with each other. So when can we market Cesar's disinfectant to the public, to the general public, if it passes the equal to one, if it's greater than one or equal to one, that means his his phenol substance can be, or his antimicrobial can be marketed around the Philippines. Okay? So Cesar, alam mo na kung anong gagawin mo kapag ka magpapatayo ka ng kampanya, ha. Kailangan dumaan muna sa mga bagay-bagay, Cesar. Okay? All right? Okay. Taray ni Cesar, sumagot talaga si Cesar, no? All right. Taray talaga, no? Natuwa ako sa pagiging active mo, Cesar. I love it. Okay. Too much information, Cesar, but yeah, wonderful. Now let's move on to the control organisms or the biological indicators that we use in each of the following. For an autoclave, remember that one already, guys. Please don't forget Bacillus stereothermophilus, because even in the ASCP they would ask this to you. For ionizing radiation, I think these things are just uncommon questions. Other two, three, and bullets 2, 3, and 4 are probably going to be probably not going to be as high yield as the one for autoclave, but I will give it to you guys again because it was given to me by a review center. Bacillus uh, pumilis and Bacillus Varniger, if you don't want to sound racist or something. And for ethylene oxide or ETO, we use Bacillus subtilis vargrobulis. All right. So those are the those are the biological indicators that you need to use. But I want you guys to please pay full attention on the biological indicators used for the autoclave, because that's going to be high yield for you. But again, I'm not saying don't remember these. I'm saying the most high yield one and the most commonly asked is Bacillus stereothermophilus. But if I were to make the exams, I would ask all of these. I would consider asking this from you guys. But fortunately for you, Mr. Marco said that I don't need to prepare an exam. Good for me because I'm not going to be tired. Good for you also because I'm not going to ask these questions, the difficult questions. So it's a win-win situation for both of us. Now, let's move on to biosafety cabinets. So in microbiology or in any clinical laboratory, you have to at least have a biosafety cabinet level 2. This feature introduces laminar airflow. All right, laminary airflow. Okay, so in any clinical laboratory, in most clinical laboratories, you need biosafety level 2. But if you're going to work with mycobacterium and certain infectious diseases such as Francisella tularensis and Legionella, you have to have at least level 3 or above. All right. Now, we're going to talk about the last topic in our discussion for today before we move on for tomorrow's specialized discussion on all organisms. And this is going we before we move on to that one, we need to take into consideration the specimen collection and storage and handling of the samples that we receive in the clinical laboratory. So the storage temperature for the following substances, for the following samples are really important. All right. Okay. For CSF, it should remain at 37 degrees Celsius. All right. And then swabs, urine, and viral culture should be refrigerated at 4 degrees Celsius. Tissue for long storage should be stored at 70 degrees, negative 70 degrees Celsius. All right. And for serum, it should be stored for 20 degrees Celsius. Do we store serum again? Do we need serum for microbial studies, sir, or for bacteriology studies? Who can answer that to me? True or false? Do we still need to use uh, pag-iisipan mo kung ako gagawa? It would be a great birthday gift for me, Sir Marco, if you give me the honor of making the exams. Yeah, it would be a great honor to me if you really if you ask me to if you give me the permission to give these guys the exam. Okay, okay. Akala ko pag-iisipan mo kung ako ang gagawa ng exam. Because previous years before you guys, I was the one making the exams for Miss Matulak way back when she was Mrs. Way back when she was Miss Kaabay. But but luckily for you, you have such a nice professor because I wasn't the one making. Because this is actually my favorite subject, by the way, guys. All right. That's why I know how to make the questions for bacteriology. Okay. So I have a question. Do we use serum in microbiology? It was a question. It was a flashcard earlier. Can anybody answer that to me? Huh. Let's select a student. Joanna Baltar. I haven't heard your voice for a very long time. Do we use serum in microbiology? All right. Specifically, what test? I mentioned it a couple of hours ago. If you still specifically what test? You're correct. Correct. But I want you to be specific. What is the term for that test? It's a German name. What is the name of for that test? Serum bactericidal test. You are correct. Di ba? Lakas maka-game ka na ba? Yung yes, that's the specific name for that particular test. No. No, that's the automated. All right, let's move on to another student. You're almost correct na sana eh. Let's move on to another student. What about who else? Noreen. I haven't heard your voice for a very long time. Let's try with Noreen. What is the term used for the serum bactericidal test? It's German. It's German. It's a German. Yes, correct. You pronounced it incorrectly. You pronounced it incorrectly, but you know. But you know. Wonderful. It's okay. It's okay. It's wonderful. Yeah. It's even if you pronounced it incorrectly, it's fine. It's fine. It's fine. At least you know. At least you know. Now, last question. How do you say that? How do you pronounce that one? I no another student. Another student. Pronounce it for me. for ano for for a prize. O, sige na nga. Bigyan ko na ng prize because I think I'm not giving out prizes today. So yeah, let's start with that question. How do you pronounce that test that Noreen just mentioned? Anybody who wants to try? 50 pesos. Load. Anybody? Wala? Hindi sila active. Pag pronunciation na questions, hindi kayo active ah. O Rainiel, baka may pang-load ka ng Genshin. Para may pang-load ka sa Genshin. O sige, try to pronounce it for me. That's your question for today. It's really easy. You just have to pronounce a word for me correctly. Joanna, how do you say it? I don't like chat. I don't like chat. No. Let's move on. Another one. Charisse. Charisse. No. Meira. Meira. No. I'm looking. No. Adrian. No. Wala na. Final na. Si Ana Jamema. I will give you. Wait, isa-isa lang. Isa-isa lang. Si Ana Jamema muna. Ah, sige. No. Isa pa. Joanna. Second chance mo na to. Last na. No. No. Last chance na, Rainiel. No. All right. So it's Schlichter test. It's Schlichter test. All right. Di ba? Walang Pinoy version. So you have to have a guttural sound. You have to have a German, you have to have a yeah, that was a question in our board exam, in our review class, and I wanted to pass it on to you guys. So it's supposed to have a guttural sound at the end. Schlichter test. All right. So I'm waiting for you guys to say. I'm waiting for someone to say Schlichter test, but everybody said Schlichter, Schlichter, Schlichter. Ganun. So very Filipino, guys. But um, thank you for participating, guys. I'm waiting for that guttural sound actually. But yeah, let's move on. 50. Sayang ang 50, no? Sayang ang 50. Nakain ko na ang dila ko. All right, guys. So we need to work on our German pronunciation apparently. So yeah, I had a difficult time. I was actually thinking if I can do this with you guys, but apparently I was able to do it. So I was practicing earlier, the 30 minutes earlier. The 30 minutes that I gave you guys earlier was actually me trying to practice how to say Schlichter test. So yeah. So anyway, let's move on. That was a fun activity for you guys. I realize I need to give you guys monetary compensation if I want to get something out of you. But anyway, these are the temperature considerations for your samples. And serum is stored for long-term storage at negative 20 degrees Celsius using for tests like Schlichter test. All right. Anyway, let's move on. What are the most commonly used transport media for stool samples? Of course, let's not forget about these tests. Somebody, haha, somebody present. Somebody raised their hand. Whatever you're about to say, please just type it because we're now focusing on our discussion. All right. So yeah, what's the most commonly used transport media for stool samples? We have Carrie Blair and Stewart, and of course buffered glycerol saline. All right. So transport media is important, and the most common ones that you're going to encounter in your exams is usually Carrie Blair or Stewart's. But let's not forget about buffered glycerol saline. All right, not buffered charcoal, buffered glycerol saline. I have to correct myself from my previous statement. It's buffered glycerol saline, right? So Carrie Blair, Stewart, and buffered glycerol saline is the transport media that we use for your stool samples. There are a lot. There are a lot more. There are tons of transport media, but for stool samples, these are the most appropriate ones. All right. So normal flora of the skin. We have a lot of normal flora of the skin, but we're going to talk about these ones specifically. All right. So we have Staphylococcus species, Diphtheriae, or your diphtheroids, Micrococcus, and Propionibacterium. So these are the organisms that are usually found in the skin. And if these organisms, if diphtheria, non-beta hemolytic Staphylococcus species and Micrococcus and Propionibacterium is seen in the is identified by your automated machine or is identified by your biochemical tests. Always assume that this is a contaminant. All right, unless there is heavy growth of these, or unless there is heavy growth, there is no clinical implications of seeing non-beta hemolytic Staph aureus and Micrococcus and Propionibacterium in the skin. All right. Now let's talk about the normal flora of the mouth. Of course, we have coagulase negative Staphylococcus and Peptostreptococcus. Wait, sir, I thought Peptostreptococcus is anaerobic. Yes, but it hides in the spots of your gums or your mouth that is not exposed to air. So Peptostreptococcus is one of those things. All right. So when would we see coagulase negative and coagulase when we see Peptostreptococcus and Streptococcus and Staphylococcus, coagulase negative Staphylococcus your in your samples, usually in throat swabs and in sputum samples. So if there's heavy growth of these organisms in the specimen, always assume that this is actually this always assume that this would probably be saliva. All right. Now, let's move on to the normal flora of the respiratory tract. So we have these organisms: Staphylococcus aureus, Staphylococcus epidermidis, Streptococcus pneumoniae, and Haemophilus influenzae. Really, sir? Really? Of course, yes. But when they move out of these parts of the body, they can cause a lot of problems. Streptococcus pneumoniae, sir, talaga, totoo. Yes, if it moves out of the oral cavity, moves out of the respiratory tract and goes into the CNS, that's the problem. That's your problem with Streptococcus pneumoniae and even Haemophilus influenzae, because these are organisms that are capsulated. And what do I say if these organisms are capsulated? What will they do, Adrian? Capsulated organisms causes diseases of the what? Even in mycology, I've discussed it before. Adrian, what about Joanna? Capsulated organisms causes diseases of the what? Last week we have what? We have what do we have last week? We have Cryptococcus neoformans, right? Yeah. So this is a capsulated organism. So what sort of diseases would we get from these types of organisms? No. And very good. Why? Because the okay. Who said that? I didn't see. Sorry. Dap sayang kung may nagsabi sana, no, sir, namamas ko po, meningitis ang sagot ko. Sayang ko. Sayang. Sayang. Pero okay lang. Pero okay lang. At least you know that it causes meningitis. So capsulated organisms such as Streptococcus pneumoniae and Haemophilus influenzae can cause diseases. So in the respiratory tract, they're fine, but once they go out of the respiratory tract, that's the time that they're going to cause a lot of problems. Uh, Staphylococcus aureus, yes, but they have to at least become they have to be at least become MRSA. Otherwise, we don't really care about them. What are we looking for in the sputum samples? We're looking for drug-resistant organisms, gram-negative organisms. Those are the things that are of utmost concern to us. All right. Now, normal flora of the GIT, of course, we have anaerobic streptococcus. That is, again, your Peptostreptococcus. We have Bacteroides as well, Clostridium, Enterococcus, and Eubacterium. All right. So I'm not gonna go one by one on this one because we have a specific lecture for these organisms, specifically Bacteroides, Clostridium, Enterococcus, and eubacterium. No, not we don't have eubacterium because that is I think normal flora, so it's not of medical importance. All right, so normal flora in the vagina is we have your lactobacillus and then Staph aureus and anaerobic gram-negative bacilli. For from for the male urethra, it is Staphylococcus species, Propionibacterium acnes, diphtheroids or diphtheriae, and of course Micrococcus. Look at the difference between these two. All right, so for the males, it's mostly skin related flora. All right, but for the vagina, because it has mucous membranes and it needs to have some sort of pH modifier, lactobacillus is present. By the way, guys, please don't forget that lactobacillus thrives in acidic environments, and that's the reason why it is it and lactobacillus is the reason why women should avoid using soap as their feminine care soap. Why? Because it sloughs off the normal flora, which is basically lactobacillus and Staph aureus and other gram-negative bacilli. Because the vagina needs to have it needs to have a certain pH in order for somebody to in order for somebody to not have infections in the vaginal tract. Um, Here in many in different nationalities, they don't have under since I've been working in a multinational um, company, and the patients come from different walks of life. I've experienced a lot of samples that I've received in the microbiology lab, wherein the women are uneducated of the implications of washing with soap, and therefore there are oftentimes overgrowth of Candida or albicans and Staphylococcus species, and that to me, and even overgrowth of gram-negative microorganisms. And that's the reason why feminine hygiene is important, because there's a lot of infections that might happen, and it's pretty common here in in other it's pretty common in other countries, because unlike our my Filipina colleagues out there, the hygiene levels, especially for the genital tract, is much more it's not a taboo subject. All right. um, in countries that are much more conservative, they they lack in these types of information, mainly because the culture itself is preventing the dissemination of health information. And if you go into these types of countries, you might be shocked, but that the comparison is, when I was in the Philippines, I was working there, we would only encounter overgrowth of Candida albicans mainly on once or twice a week. Okay, and these are usually from elderly patients who haven't been taken care of. But when I arrived here, almost every sample that comes in from female patients, there's one or two people who don't have overgrowth of any particular microorganism, and that to me is a stark difference between our cultures, because of the taboo subjects of cleaning one's genitalia. So yeah. So congratulations, kasi lahat ng mga karamihan ng mga pasyente natin diyan sa Pilipinas malinis. All right? It's not so much in other countries. I'm not saying just in this country, but in other countries as well, because we received samples from other nationalities when we were here. Because here specifically in here in my location, it's not just the people, the locals here that are being tested. There's other people from other countries as well, because it's a melting pot of different cultures. All right, so now let's move on to transmission of normal flora and other opportunistic bacteria. So how are they transmitted? Or they go through different places. They go through different routes actually. So it's either through ingestion, inhalation, sexual contact, zoonosis, vector-borne transfer, and skin penetration. All right. So normal flora can uh, can travel to different places. Okay, and these are the ways that they may travel one by one. Okay, so these are the things that these are the conditions in which they can go. As I mentioned before, um, for example, inhalation. The normal flora of the respiratory tract, we have Haemophilus influenzae and Haemophilus influenzae and Streptococcus pneumoniae. Imagine if the patient is immunocompromised and somebody gave him a kiss on the cheek. So would it be possible for that person, I'm talking about specifically about a baby, to get the disease from the from a seemingly healthy individual, and then a small kiss on the cheek can get the person infected? So yes, it is possible. It is extremely it is extremely risky to allow a child, especially a small, so maybe around 2 to 3 to less than 3 years old, to have a kiss from strangers, because it might be normal flora to that particular stranger, but if the baby is, of course, immunocompromised or suffering from an underlying condition, then that patient might have a disease in the long run. All right, so it might be transmitted for that patient, and a disease might come in afterwards, after several hours of incubation. So what aseptic technique is done in the extraction site for blood cultures? We use, of course, your 70% alcohol, iodine, alcohol again, 70%, and then we extract. Is this the proper way? They will ask you a question this way: which of the following is the correct procedure in collecting blood? Is the correct procedure of collecting blood from for a blood culture site? Please don't forget this one, because this was a question that was asked in the board exam. All right? This is the proper way. They will ask you which of the following is the false procedure, or is the only all of the following are false except for this. This is how they will generate the questions for you, and you have to be mindful of each and every step, especially for procedural questions. What do I say? What do I mean by procedural questions? What is the correct procedure of gram staining? What is the procedure of doing the Kinuon method for AFP testing? So you have to be mindful of that one. And I think we're almost about out of time, but I'll try my best to finish at least a handful of this after that, and then I'll leave the rest for you guys to peruse on your own time. But yeah, the anticoagulant used in blood cultures is, of course, SPS, or sulfophonetol sodium sodium polyanethol sulfonate, which is at 0.025% concentration. All right, so what it does is it neutralizes the bactericidal effects of serum, and it inhibits in vivo phagocytosis. All right, what is again the importance of using sodium polyanethol sulfonate? It neutralizes the bactericidal effects of human serum. Why? Because in immunology we have cytokines, we have a lot of we have a wide variety of things that complement antibodies, whatnot. These things can cause bactericidal effect. These things have bactericidal effects on bacteria. And in blood cultures, we want to preserve these bacteria, and we want to take care of them. And one way to do that is to use sodium polyanethyl sulfonate at 0.025%. All right, and it also inhibits in vivo phagocytosis. If organisms are phagocytized by blood cells present in human blood, then that means that the blood culture would be rendered useless. Why? Because there's no more organisms or colony forming units that are going to be allowed to grow in the bottles. Now, let's move on to best time to draw blood cultures. The best time to draw blood cultures is during the height of the fever. And how many collections are usually done? We usually collect it on 2 sites. All right, and it should not be in not more than 3 in a 24-hour period. All right. So if you go and work in the hospitals, you're going to experience blood culture bottle number one, blood culture bottle number two, and this depends again on the prerogative of the physician. But based on based on what is usually asked in the board exam, it's collected at the height of the fever or a fever spike. Okay, and there are only two collections, and there's only two collection sites during that particular fever spike, and it should not be more than three in a 24-hour period. Okay, because it would render the test it would render the same results. It would yield the same results regardless of whether or not it's positive. Okay, so blood specimens for culture are ideally extracted prior to antibiotic treatment. However, patients who have taken antibiotics prior to collection has special indications followed. They should have they should have what? They should have containers that have antimicrobial removing devices. Um, Specifically, we want to use penicillinase containing uh, antimicrobial and blood culture bottles for patients who are taking penicillin. For patients who are taking tetracycline, there should be magnesium sulfate in the bottles. But these again are traditional ones. I'm just jotting down some of that might be asked in the board exam for you guys. And then for sulfonamides, you have to have para-aminobenzoic acid to neutralize the effects of sulfonamides. All right. Now, charcoal is actually one of the most commonly used antimicrobial removing device in the in blood cultures, and I think it rendered everything here in this slide relatively useless. But again, for the purpose of the board exams, I provided this for you guys. But if they ask you in the board exam which of the following is the best and charcoal is one of the choices, please select charcoal. Okay. All right, so I think we will end here with how much blood should be extracted for cultures from the following patients. All right, so for adults, it's ideally 10 ml, 5 ml on both sides. All right, left and right arm. And for children, it should be around 1 to 5 ml. All right, why? Because they are relatively small in stature. And yeah, um, ideal dilution for broth. Yeah. Before we move on, sorry, I have to take in a little bit of time, because this is again important. Ideal dilution of blood in with broth media should be at least 1 to 10%, specifically for the Castañeda broth for Brucella. All right, for Brucella blood cultures. Brucella blood cultures are different because they are read at 7 to 21 days. The normal blood culture is around 7 days only. Okay, for Brucella, it's extended up to 21 days. All right. So yeah, that's the end of our lecture. So hopefully you guys have learned something from me this time, aside from Gin Bulag. And yeah, and the lectures will be posted in a playlist dedicated for my lovely students. All right, and the links are provided here. Yes, talagang pinrovide ko yan para hindi nyo ako makalimutan, guys. Pinrovide ko talaga yan for you guys. All right, I know pambobola 'yon pero hindi ka mananalo ng prize. Anyway, I would like to say thank you for Sir Marco for inviting me. I'm gonna be here tomorrow, but I would not forget saying thank you all again and again to Sir Marco. And you guys if you guys want to access the videos, it's there for you guys. All you need to do is just listen, blah blah blah, whatever, and I'll provide the details for after this lecture. All right, bye everybody, and have